Let's talk about planning treatment. A successful plan defines the sequence of actions for a practitioner to meet the client's goals. A plan is simply taking a task and breaking it down into smaller steps. And really, in this case, we're talking about nesting plans. We have a plan for the business. Within that plan for the business, we have a plan for today that we generally call our daily schedule. Within each one of those sessions in our daily schedule, we have a plan for trafficking patients. Here's how they're greeted. Here's where they wait. Here's how they're brought to the room. Here's how they're returned from the room. Here's how we reschedule them and get money from them. Once they're in the room, this presentation is about the framework of what happens in that room, or the plan for a session. I've already broken it down into individual pieces like goals and assessment and planning and treatment, and etc. Now we're in the treatment plan. We're going to take that and actually break it into integrative sequences. Plans manage expectations. Once we have a successful plan, or once we feel like we've put together a good plan, it does several things that make the expectations of the client and the expectations of the practitioner to be less stressful. First of all, they provide consistent results. If I figured out that treating this particular muscle adds about 4 minutes to my session, then I can predictably change my session, and it's easy to take out 4 minutes from some other parts and fit this extra piece in. Plans manage time. Einstein said that time is the succession of events, and so planning helps us to put in the events that help us realize our goals, that are successful activities, and to get rid of activities that are less successful. Plans also reflect experience. They tend to say that I've thought this through and I've done this before and here's the way this thing should work. Once I'm able to say to a client, okay, this thing that we're going to do is going to take a little bit of extra time. I'm going to need to change your session this way to do it. That helps the client to have better expectations about what's going to happen in the room and allows them the opportunity to say, I'd prefer to do this other thing. So plans are great at managing expectations. Okay, there's a couple of obvious problems. First of all, you already have a plan. To add new techniques or have a client come in with some unusual problem, it means that your plan has to change. You probably have a plan for doing a full body session starting face up. And you probably have a plan for doing a full body session starting face down. And you probably have a plan for doing a full body session that focuses on neck and shoulders. And a plan for focusing on low back, etc. You may even have some other plans that are specialized protocols. Maybe some stretching protocol that you learned that adds a completely different style to your massage session, or maybe you learned this 10-step protocol from someone. So you already have plans, and the problem is we want to change little things. We either want to introduce new techniques, or we want to be able to change the plan to accommodate this client's particular special request. Integrative techniques are particularly good for taking new problems or unusual problems that the client has and integrating them into your session. There are several reasons for this. Integrative techniques tend to be faster than other techniques. They also tend to be quite gentle and kind, easy to work with. They're more effective, and so we can implement them with confidence, and clients tend to see better results. They see better results because these techniques tend to be better at creating bodies that are self-correcting. Once we understand that these integrative techniques are faster, gentler, more effective, self-correcting, we're able to take our session, easily integrate an integrative sequence, And that leaves us time for other things. That leaves us time so that we can implement some stuff that we want to try. We may intuit that there's some other stuff that needs to be done. We may discover something during the treatment that we'd like to do in order to offer some work that's supportive or palliative that helps the client feel better when they leave the session. I generally see three approaches to putting integrative techniques into a session. The first one is to have the integrative bodywork plan. If you've taken integrative bodywork, there's kind of a process that you begin doing cranial releases first, and I like doing this particular style. It works in my practice. I talk to my clients about it. I help manage their expectations about why we would want to do things this way. And if they're agreeable, I take that approach. The second way that I've seen is that people do integrative work first. One of my students wrote a review that said, a person came in with this particular problem. It took me about 10 minutes to go through and balance their pelvis and release this muscle. And then I had the rest of the session to do a regular full body massage. The third option is to mix integrative techniques in with your regular plan. It's not that hard to do. I'll talk about that when I go through our examples. Let me mention a couple of other things that are important for planning. First of all, symptomatic treatment makes people feel good when they get off the table. Symptomatic treatment targets ancillary components and offers relief. Integrative treatment targets governing components. It offers lasting results because it tends to create a body that's better at self-correcting. That means that releasing the highest governor renders a body that's better at self-correcting. That means that if you can start with those high governors, and you can work them into your session early, the work that you do on those ancillary components will be easier for you and easier for the client. It means that those trigger points have been pre-released and you're not going to struggle with treating a muscle that's being held by some joint or some trigger point that's being activated. Let's talk about a plan for our two examples. First, let's start with Peroneus Longus. I'm going to skip over the cranial work till the end of this session so that we can kind of see how the rest of it fits into a typical bodywork session. First of all, we need to go ahead and take care of the upper cervical. You may be saying to yourself, why would I take care of upper cervical work for a problem in the Peroneus Longus? I can tell you from working at an Atlas orthogonist practice for some years that I've had problems with my Peroneus Longus, and they can set my Atlas and it fixes the Peroneus Longus. In our case, we're not really capable of setting it that precisely, but if it's stuck, it tends to perpetuate the pattern. So we want to go ahead and mobilize that Atlas with this mobilization technique, and then follow up with a little suboccipital routine so that we can free up the muscle so that the Atlas is mobile. Next, we need to take care of the posterior shear by doing an anterior shear. You can find that in this post. I don't really do work in the pectoral girdle for this, but we need to take care of the nerve pressure that might be coming off of the L5-S1 joint, and one of the ways to do that is with this lamina groove routine. I tend to use gentle mobilizations of the vertebra, followed by a little bit of trigger point work in those multifidi and rotatories in the low back. Next, we need to mobilize the local joints. This is built into the post for the therapist notes of Peroneus Longus, but this post on joint mobilizations will help to explain that. Lastly, we may choose to do some direct work in the muscle. This neuromuscular routine is helpful there. Now, if we're looking at a full body session, what we really need to say at this point is, how do we work this in? And so we would want to create some sort of full body routine. I prefer to start this face up, where we can simply go from head to trunk to pelvis to low leg so that we can work these pieces through in this order. So I would typically start this person face up and work from head to low leg and then turn them over and maybe do the low back work at the end. Now let's look at infraspinatus. It's actually even easier. We're simply going to start with a little atlas mobilization, then a little suboccipital work. That'll free up those muscles so that the atlas will be mobile. I don't really do pelvic girdle work for infraspinatus. Next, I'm going to do a little shoulder work. This also is built into the infraspinatus therapist notes, but here's that post on joint mobilization so that you can take a look at how those joint mobilizations work and why they work. Next, I'm going to do a little muscle work there in the neck. I could do that through this neuromuscular routine with the cervical lamina, making sure that I focus on C4 through C6. Those vertebrae are not compressing nerves. After that, I would do a little work on the humeral head. Again, this is built into the infraspinatus post, but here's the post on joint mobilizations. Lastly, I would go through and do some work directly in the muscle for a couple of reasons. One is that I want to free it up a little bit more. I probably felt that release during the mobilization of the humeral head, but I also just want to do a little extra work in there to help the client feel like I've addressed the area that they've complained about. Okay, so there's those two pieces as I would fit them into a typical bodywork session. If you're trained in craniostructural work, this lateral strain technique in a structural release is particularly helpful for dealing with the cranial components that perpetuate the postural issues that to activate this trigger point in Peroneus Longus. However, this work takes a little longer. This lateral strain technique, I've watched people work with it, and it can take anywhere from 10 minutes to 45 minutes to do the complete release. And so if I'm going to do this release, I typically have a session where I do this release and the pelvic work and the other joint mobilization work separately from the soft tissue work. Or I have a longer session. Now let's talk about the infraspinatus cranial work. Typically, this is dealt with pretty well through doing some structural releases of the coronal suture. That work takes a little longer than some functional release of the coronal suture and adds a little time to the session. You could implement this still pretty easily in a full body work session, especially if you're doing a 90-minute session. There are some other cranial pieces that need to be dealt with here. This is part of an anterior atlas that creates a forward head posture, and dealing with some things like superior vertical strain helps to get rid of the postural issues that perpetuate the shoulder issue. Okay, those are the ideas around the treatment plan for these two muscles. Let's move on.